Hello everyone, Dr. Suneel Dhand, internal medicine physician. Welcome to another video. One particular problem that I spend a lot of time dealing with both in my health coaching and in my academy is people who are suffering with low energy levels. People who feel like they are losing control of their health, they're very busy, they don't know what's happened to them, they're not as energetic as they used to be, and I spend a lot of time helping them get back on track and giving their brains a boost. And most of the time, the problem isn't something organic, pathological, or a disease, and the solutions rest in the adoption of an anti-inflammatory, real food diet and the ideal lifestyle medicine techniques, which usually does give the brain a massive boost. Having said that, there are some conditions out there which cause low energy levels that are important to rule out, especially if symptoms have occurred abruptly. And in this video, I would like to share with you some very important blood tests to keep in mind if you are suffering with low energy levels. Number one, a complete blood count. Now, this should be a fundamental on any basic lab drawer. Whenever anyone is getting basic blood tests, this is usually included. And specifically in a complete blood count, I am interested in somebody's hemoglobin, even if it is at the lower range of normal. Is somebody anemic? And then what is their iron level? Because iron deficiency is a very, very common reason for people feeling lethargic and having low energy levels. Number two, what is somebody's fasting glucose? Their HbA1c, which measures glucose control over a period of about 3 months. And then if we want to be really smart and take things a step further, what is somebody's HOMA-IR? Their homeostatic model assessment of insulin resistance. I've made videos about this topic before. The link is down below. Insulin resistance is a huge reason for people feeling lethargic, tired, and having low energy levels. And it's almost completely ignored by the medical establishment. They rarely talk about insulin resistance as a reason for people having low energy levels. Number three, what is somebody's vitamin D level? This is another blood test which isn't checked anywhere nearly enough. If it was up to me, I would check everybody's vitamin D levels, especially in Western countries where people are indoors so much, at least once a year. Because vitamin D, as well as being crucial for bone health, crucial for immunity, there is a strong link with mental health, with depression, with not feeling good. That's why it's a really good idea if you have low energy levels to check your vitamin D level. Number four, CRP, C-reactive protein. I've made videos about this before. This is an underutilized blood test which is excellent for detecting underlying inflammation. And you want a value which is in the single digits. If it's elevated in the high double digits or sometimes even over 100, it can indicate that there is a significant underlying inflammatory process within your body that needs further investigation. Number five, thyroid function. Often this is checked routinely in people who are not feeling good, but both low thyroid and high thyroid function can lead to people not feeling good and having low energy levels, usually more associated with low thyroid function. And typically the first test that we get is a test called TSH, thyroid stimulating hormone. And this can get a bit confusing for some people. There is a process in the body known as a negative feedback loop. And basically a high TSH, a high thyroid stimulating hormone, goes with low thyroid function. It goes with hypothyroidism. And typically the next step, if your TSH is abnormal, obviously there are different cutoffs, but if your TSH is abnormal, you want your other thyroid hormones measured, the T3 and T4 thyroid hormones, and then hopefully your physician can take the diagnosis from there. But typically, thyroid function tests are included in any panel when people are saying they're not feeling good and they're feeling lethargic and tired. Number six, some other blood tests to keep in mind. A complete metabolic panel to assess the kidney function, the liver function tests, and also specific electrolytes that I would be interested in are potassium and magnesium. Are these key electrolytes low? That can lead to lethargy and tiredness. And beyond that, some other notable tests to mention: testosterone if you are a male, and also cortisol tests can be done. That's a little bit more of a more complicated test that can be done if adrenal insufficiency is suspected, causing tiredness. That can often go with other factors as well, including a low blood pressure. So there you go then, some very important blood tests to keep in mind if low energy levels are a problem for you. And like I said at the beginning, in most people, the issue isn't pathological. It is lifestyle related, which thankfully is very fixable. Nevertheless, if you are suffering with low energy levels, have any other worrisome symptoms have occurred abruptly, it is still important to rule out any other underlying condition, and those blood tests may well help you. Please speak to your physician about them. I hope you found this video helpful. Feel free to comment down below. Check out my academy and my free newsletter. Those links are down below. Have a fantastic Thanksgiving, everyone. Hit the like button if you like this video and the bell button for more similar videos in the future. We will speak again very soon.